professional, but I'm here to speak in opposition of House Bill 5044. I'd like to start off by saying, one, I agree there is no current emergency. Connecticut is experiencing a high rate of immunization in the state. It's my understanding we had a downtick of something like 0.8 of 1% one year over another. House Bill 5044 is looking to take away existing rights from folks, or at the very least, you're asking parents to choose between the U.S. Constitution, freedom of religion, or Connecticut State Constitution, free public education for all children. That is something that I think is wrong. In the mid-'80s, required vaccines are in the less than a dozen for kids 0 to 18. Now it's approaching 40 and rising, and that's a concern for many parents. So removing choice from parents who, for example, there's an inequity in this law. Some parents can afford to homeschool their children. However, those that are economic disadvantaged folks will not have that opportunity. I think that's wrong. And what's next? I think it's short-sighted. If we take a look, we're banning unvaccinated children from public schools. What about public libraries? What about playgrounds? What about other public places? How about amusement parks? It's really short-sighted. I think we should look at the situation and monitor it. And I think going to the extreme of banning these kids from schools, I think is wrong. With me today, I have Byzantine Catholic priest Michael Copenhagen to take up the rest of my time.
So I'm a Catholic priest in union with Rome in New York State. I teach philosophy and theology and other subjects, including the sciences. And I have 6 children who cannot attend the religious school where I teach and are effectively quarantined despite the legal mandate to receive IEP services because I refuse to violate the moral law, which includes the injection of fetal cell derived vaccines from the WI-38 line. You can refer to Dr. Teresa Deischer's affidavit for that. Many Catholics and conscientious people, upon a thorough moral analysis, see a clear, immediate forced cooperation in the intrinsic evils of theft, desecration, experimentation, and trafficking of human remains obtained through violence to produce the product, regardless of the documents and policy statements to date by some individual bishops and dioceses, bishops' conferences. This remains a magisterially unsettled question, which means that a Catholic of well-informed conscience who judges compliance with such a vaccination morally impossible is bound in Catholic teaching to refuse the procedure. Cooperation with other means, there are other things in the schedule that are morally problematic, but in the interest of time,
Please finish your sentence.
well, essentially, in the interest of time, I was going to say there are 2 points. In Catholic teaching, if you refer to the Catechism of the Catholic Church, informed consent is undermined by coercion, and this is an extreme form of coercion that causes segregation. And then also with regard to families, the teaching of the Church consistently is that they have a right, a fundamental right, and my testimony has all the references to the Catechism that say there's a right in conscience to choose where their children go to school and to be the ultimate determiners of that, which you'd be usurping if you were to pass this legislation.
Well, please do submit any written testimony to that effect. Thank you. Are there questions or comments? Not. Again, thank you, Senator, and your guest for testimony. Next up is Dr. Stacey Taylor, then we're going to have Senator Champagne, and then Dr. David Banish.
Good day. Not enough? I am Stacey Taylor, family physician in Torrington. Thank you for letting me speak in support of House Bill 5044 and on behalf of my colleagues in the Connecticut State Medical Society and Academy of Family Physicians. Some of you have heard the story of Scotty, but for those who have not, he was a 5-year-old lively boy who one day did not feel well. He died 1 week later. It was 1953. That year, of the 57,000 plus with polio, my brother and 3,144 others died. Over 21,000 developed paralysis. 1 year later, the first polio vaccine became available. How far we have come, how easy we forget. As physicians, we devote our lives to using scientific, evidence-based medicine to help our patients. What is the evidence for vaccines? They have prevented hundreds of thousands of deaths, contributed to longer life expectancy, reduced health disparities, improved quality of life, and saved trillions of dollars in costs. Immunizations are safe and effective. They are a routine part of how we care for our children. They do have potential harms. The benefits, though, far exceed the risks. Riding in your car today is far more dangerous than any vaccine. Despite this, the CDC estimates that 1% of children receive no vaccines. Vaccine-preventable diseases, VPDs, are a threat. A few ill people can lead to the reemergence of VPDs when the numbers of unvaccinated increase. While confidence in vaccines is consistently high, there is a growing minority in our state who are hesitant to vaccinate their children. The measles outbreaks provide an example of vulnerability to VPDs. After coughing or sneezing, the measles virus remains infectious for up to 2 hours on surfaces and in the air. 90% of exposed non-immune people become infected. Before the measles vaccine, 3 to 4 million people got measles each year, 400 to 500 died, 48,000 were hospitalized, and 4,000 developed encephalitis. Despite a 99% reduction in measles due to the vaccine, in 2019 there were 159 cases, a few of those in Connecticut. Due to an increase in unvaccinated children, an outbreak of measles in some of our public schools could lead to the illness or death of children who are not vaccinated. How could such an outbreak begin? As the coronavirus demonstrates, we are living in a smaller world where disease can travel quickly from country to country. Many people in other countries do not have access to vaccines. Unvaccinated ill people can easily travel to the U.S., and unvaccinated people can come back to the U.S. and bring disease. May I finish up with just one more comment?
Very quickly.
Okay. We need to respect individual rights, continue to educate with scientific facts, yet protect each other, our schools, and our communities.
Thank you, Dr. Taylor. Other comments, questions? Representative Cook?
Thank you, Mr. Chairman. Thank you, Dr. Taylor, for waiting so long to testify. I have 2 questions. The first would be, could you address the comment about that we've heard over the last few hours, the argument about the pressure that doctors feel or the assumed pressures that could be possibly placed on the medical professionals to vaccinate or over-vaccinate? That would be my first question. And then the second one, do you have suggestions to offer that would avail us to widen the medical exemption for the 3 limitations that have been discussed earlier, and what that might look like from your professional opinion?
I feel that there has to be an honest discussion with patients that may not be taking place currently as to the benefits and the risks of vaccines. I like the idea of expanding the discussion and allowing reimbursement for the discussions. I don't think it's appropriate to have someone come into your office and say, hey, it's time for your vaccine, let's give it, without having informed consent. I think if you have informed consent and you give some motivation with that, the pressure does decrease on both sides. The patient shouldn't have a lot of pressure, the physician shouldn't have a lot of pressure. I think physicians have to be more aware about what the true contraindications are. I don't know if all physicians are aware of that. And if we know what the contraindications are and we truly listen to our patients, I think pressures will be relieved.
So to follow that, do you believe that there is a CDC pressure for the medical professionals to over-vaccinate or, quite frankly, to vaccinate?
I don't think there's any pressure at all. I think we believe that vaccines on an individual level will keep the children safe. I do not want any adult or child that I take care of to die of a vaccine-preventable disease. That would be the worst thing I could think of.
Thank you.
Other questions or comments? Now again, Doctor, thank you for your patience there. A lot of people are going to be patient today. Next up is Senator Champagne, and the next elected official would Representative Gilchrist. Between that would be Dr. David Danish, followed by Dr. Kevin Deakhouse. So right now it's Senator Champagne.
Thank you. I did have somebody with me, but I can't seem to find them, so I will speak myself. I think this law, it oversteps government authority. People should have a right to decide who or what goes into their own body. You know, these exemptions, we start stepping on our constitutional rights. We start going into our religious freedoms. People shouldn't have to explain themselves on a religious freedom. You know, if I believe, and they admitted it here, that the original cells came from an aborted fetus. I mean, I wish I would have known that before I got my vaccines, because that bothers me. But I see us intruding on our First Amendment rights. I see us intruding on our Second Amendment rights. Where does it stop? And one of my main concerns is what vaccines are going to be added to this list in the future. Because I can see that next if this law passes. And I think a lot of people are worried about that. I did not give my daughters the Gardasil vaccine. And it was a choice that my wife and I made. Mainly because I'm looking around and I can see those injured by it in my own community. And I have an issue with that. So I think I'm making my point. I wish the person who was going to come with me was here, but they're not. So I've stated my opposition to this bill, and I will vote against it when it comes to the House. Thank you.
Thank you, Senator. Comments or questions? If not, thank you for your time. Next up is Dr. David Danish. The next public will be Dr. Kevin Deakhouse. But in between, we'll have Representative Gilchrist, followed by Commissioner Vile.
So thank you for the opportunity to speak. My name is David Bannock. I'm an infectious disease physician in Connecticut, and my testimony represents members of the Executive Board of the Connecticut Infectious Disease Society. We're a professional society that consists of infectious disease physicians, pharmacists, and public health professionals. This testimony has been reviewed and represents the opinion of the members of this board. As infectious disease physicians, we testify on behalf of our colleagues as well as our patients. Collectively, we have witnessed tremendous advances in the fields of infection prevention, acknowledging the life-saving advances of vaccinations. Unfortunately, we have also and continue to provide care to patients who have suffered from vaccine-preventable illnesses, many of whom have been left with debilitating lifelong consequences, and some of whom have not survived. We have seen the devastating impact of measles and mumps, including patients who have suffered neurological injuries from both illnesses, as well as infertility attributed to mumps infection. We have seen patients die from meningococcal meningitis, a life-threatening infection that can be prevented by vaccinating groups at high risk for infection. And we have provided care for patients who have died from whooping cough and tetanus, both of which are vaccine preventable. We also provide care for patients whose immune systems are extremely weakened, including patients with HIV infection, those on immune-suppressing medications for autoimmune or rheumatologic conditions, those who receive chemotherapy for cancer treatments, and those who undergo solid organ and bone marrow transplantation. Because of their immunosuppression, receiving the measles, mumps, and rubella vaccines, all of which are live vaccines, is medically contraindicated. Protecting these vulnerable individuals relies on the immunity of the individuals who are eligible to receive the vaccine. Additionally, young infants are often too young to be fully immunized, and elderly who have been immunized in childhood may have waning immunity, rendering these groups susceptible to these life-threatening infections. If we do not maintain immunity to these infections in our community, our vulnerable patients who cannot be fully vaccinated will suffer the consequences if they become exposed. Lastly, as representatives from acute care hospitals in Connecticut, we also bring attention to the impact of an outbreak of vaccine-preventable illnesses on our healthcare system, particularly on our hospitals, most of which are already operating near or at full capacity. Given the highly contagious nature of these diseases, each case in an acute care hospital requires an immense diversion of infection control resources, including the reassignment of highly trained infection prevention staff. These are finite resources, which, if diverted, cannot be otherwise dedicated to other critical prevention activities, including preventing healthcare-associated infections and protecting our healthcare personnel from infection, thereby jeopardizing all patients in Connecticut. The raised bill 5044 is an opportunity for Connecticut to take a proactive rather than a reactive approach to a critical public health issue, which has the potential to endanger the lives of some of our most vulnerable residents in Connecticut and potentially lead to an unbearable cost to Connecticut's hospital and public health systems. I'd be happy to answer any questions you may have. Thank you.
Thank you, Doctor. Other questions, comments? Again, thank you for your time and thank you for representing the infectious disease practitioners. We're going back to the elected officials. I've been advised it's important that if you as an elected official are bringing up someone to testify with you or to use your time, that you make sure you give us that information so we have a written record of who that individual is. And if anybody who is already testifying is watching, please get that information to the Public Health Committee Administrator. So next up, we have Representative Gilchrist, followed by Commissioner Bai, and on the public side, Dr. Kevin Decaus, followed by Dr. Linda Nicolai.
Hello, Representative Steinberg, Senator Abrams, and members of the Public Health Committee.